Now more than ever, innovative technologies are fueling change and sparking new ways of thinking. Collaboration between corporations and startups is key to staying at the forefront of these trends. However, finding the right startups can be expensive, time-consuming, and ineffective. But Plug and Play is here to help. As a corporate partner, you will gain access to a whole ecosystem of innovation. Discover startups that meet your tech interests. Stay updated on the latest trends and network with industry peers. We will help you during every stage of your innovation journey, no matter where you are and where you want to go. Get in touch today.
So now I'd like to introduce our esteemed panel speakers. Dr. Neil Mills is Chief Medical Officer, as I said, of Aon's Health and Benefits Practice. He serves their clients across North America to assist them with the strategic and tactical planning and implementation of health programs that they need, especially those that address the challenges in healthcare delivery and finance. He serves on numerous Aon teams, including the Global Task Force on COVID-19, the Health Innovation Team, and the Health Transformation Team. So you can see he is very much at the intersection of advancing healthcare delivery. He has co-authored many of Aon's most well-received points of view for employers, including their best practices for COVID-19 return to work, emotional fitness, primary care, digital health, digital medicine, and many others. And Neil has spent nearly 2 decades in the practice of medicine with a focus on family medicine. And that time includes 4 years at the U.S. Air Force. So welcome, Neil. So nice to have you here today. Have you get your...
Thank you. Thank you so much. Glad to be here.
All right, great. Thank you so much. And also we have Bobby Uyama. He is Senior Director of Frontier Business Office for Sumitomo Dynapon Pharma America. And in his role, Bobby creates new value by launching healthcare solutions and exploring potential business collaboration that uses artificial intelligence or real-world data, virtual reality, creative combination kind of the conventional drug device with disruptive innovations to bring kind of new therapeutic options and healthcare solutions to the patient population and their devoted caregivers. Bobby has worked for Japanese pharmaceutical companies at both Sanovian Pharmaceuticals and Sumitomo Dynapon in a corporate function for more than 25 years, seeking to advance healthcare through the solution-oriented lens. And whether it's M&A transactions or commercial alliance management, he's been there, and he received his master's in law and his master's in comparative law from the University of Pennsylvania Law School and is admitted to the state of New York. So welcome, Bobby.
Hello, everyone. Thank you for having me. It's really a pleasure.
Great to have you guys here. So we can stop the slides and get right into it. Thanks again, both of you, for joining us today. I'm really excited about this conversation, but I would like to start by defining digital therapeutics. It's different than digital health, as I mentioned. There's a component of intervention, clinical evidence, and so on. I was wondering, Neil, if you could kind of start us off with your interpretation.
Sure. So digital therapeutics basically ensures that those devices that come through that pathway are following evidence-based guidelines. These would be the guidelines either set forth by some government bodies or academic societies, so for a whole host of conditions.
Great. All right. And Bobby, why don't you add from a pharmaceutical perspective, what does digital therapeutics mean to you?
Yes, thank you. So to me, or pharmaceutical industry, it's really the heightened level of scrutiny in terms of the clinical evidence, because you have to go through the regulatory pathway. And that means you have a robust clinical data, which is really the expertise in a pharmaceutical industry for developing the conventional pharmacological drug, if I say.
Great. And do we always need to have regulatory approval to categorize something as a digital therapeutic?
So not necessarily. Not all digital therapeutics will go through the FDA approval purview, but in many times there is the enforcement and regulatory oversight by the FDA. It'll partially depend on whether it's substantially equivalent to other therapeutics that have received the FDA approval or whether it's novel. And so ultimately that enforcement discretion is up to the FDA.
Got it. Got it. Bobby, did you want to add on to that one as well?
No, that's a great summary about the where we stand relative to the regulatory pathway. Thank you.
Cool. I see the difference. But an important aspect of this digital therapeutics is kind of the adoption of many players, right? So, and how it integrates into the healthcare system. And I understand in doing some research on this that one of the issues is sort of payer adoption. So Neil, I'd love to start with you and kind of addressing from a payer perspective, how are you seeing these? How are you adopting them? I mentioned in your bio, you're working with employers to find the best health programs. What are the employers saying and what's your focus there?
Sure. So many payers are vastly interested in this because of the economies of scale that can be achieved. Of course, every time we show up at the doctor's office, brick and mortar is very expensive, but there are now these evidence-based guidelines that can be wrapped into these digital therapeutics where in your pocket, you have access to cognitive behavioral therapy because that can be turned into algorithms and guidelines that follow some of the psychiatric and psychology guidelines. So that is incredibly appealing considering some of the access issues that we have. And so for some of these major pain points for employers, diabetes, cancer care, cardiovascular care, the failure of continual care management and chronic condition and lifestyle management, these devices offer that opportunity to be prompted throughout the day to not only ascertain your progress and how you go about managing your lifestyle, but to achieve better outcomes and better management of those chronic conditions.
Right, great. And then, Bobby, what is pharma's interest in integrating digital therapeutics into the healthcare system? How are you looking at it?
So in my view, compared to the conventional pharmacological solution, maybe when it comes to the digital therapeutics, we can provide a much more robust data from the real world usage that will turn into some kind of analysis or assessment early on so that the patient and the physicians can collaborate to make sure the current regime is correct or not, and what kind of adjustment is if necessary, so that we can provide or contribute to this idea of value-based care through the DTX, I believe.
Great. And then obviously, physicians need to adopt it as well. Maybe Neil, as a physician yourself, where is the first adoption step? Obviously, like if we have a digital therapeutic that, let's say, has regulatory approval, is it the physician bring it into the practice first? Is it the payer? Can you kind of walk us through how the physicians approach it?
Sure. I mean, in some instances, the physician, as you shared in your introduction, may be prescribing this, and therefore the payers get very involved because if the prescriber is going to be writing you a prescription for this, then maybe the PBM or the carrier will need to cover this. And the carrier PBM may be going back to the employer and saying, is this something that you want coverage for, or what is your policy around digital therapeutics at large? In some instances, the employer may be providing digital therapeutics directly to their employees for certain conditions that are dramatically impacted by your lifestyle choices. So the very first ones that come into play here may be around substance use disorders like nicotine, smoking, diabetes, certain mental health conditions where you can follow those evidence-based guidelines pretty straightforward through digital therapeutic tools.
Do you think employers are on that bandwagon already? Like, have they figured that out, or are they slow to adopt?
They're looking at this now, and some employers are very interested in something called a virtual tier amongst their benefit designs, where the very first benefits that are available at the lowest cost, or maybe even no cost, are therapeutic tools that you can do at home. So for example, musculoskeletal physical therapy is simply you interacting with the device. The device is evaluating your physical therapy movements to make sure that you're doing appropriate rehab, and there may not even be a physical therapist involved. And so considering the savings that could be achieved, employers are very interested in their doing this now.
Got it. Bobby, did you want to add to any of that? Maybe from the patient perspective, I know we had chatted about that earlier, just how's the patient responding to these digital therapies?
Yes. Maybe this comment is not coming from pharmaceutical hat of myself, but more patient on my own. So if I have some problem mentally or physically, I would like to seek for some help or guidance appropriately, regardless of the time and regardless of the geographical location. But in the real world, you have some limitation or much limitation to get the access to the first level attendees by the physicians. Where should I go and when should I go? Those kind of experience is really sort of difficult as a lay person in the medical world. But as Dr. Mills pointed out, maybe the digital solution can decrease the barrier from the patient perspective so that we can funnel the appropriate patient level or group to the appropriate providers, so that as a society, we can make most of the system we are trying to achieve.
Right, that's great. And then Bobby, can you speak about the areas that you guys are interested in the development, sort of disease states and so on? Where are you really looking when it comes to digital therapeutics?
I see. So this time I will put my pharmaceutical company's hat, and my company has two kind of specialized area. One is mental health or CNS. So this area is really complicated and it's difficult to manage, whether it's a therapy or pharmacological solution. And that's why our company or our team is identified this probably is one of the areas digital solution can help patients and caregivers. So by the use of data, as well as the algorithm, maybe we can help the better management of the mental health, for instance.
Got it. That's great. Yeah, what about, is there a special area at Aon that you guys are focused on when it comes to digital therapeutics?
I think we are keenly interested in those that the evidence has been emerging, and therefore, several hundred, if not thousands of studies have supported that they can indeed improve health outcomes. And the ones that seem to be leading in this area are the diabetes, musculoskeletal, and mental health. But we're also interested in others that will be stepping into that space soon.
Got it. That's great. And then I'd love to ask you about digital therapeutics, and do they stand on their own? Must they accompany a therapeutic? Is there a combination that's ideal, or what have you seen emerging? Maybe Neil, give that a shot. Just give me some idea of whether they really can be prescribed by themselves, or whether they usually will accompany some kind of medication.
So far, we're seeing evidence of both happening, where they're co-prescribed with another therapy. I'll defer to our other speaker about those in the pharmacy realm, but you may be seeing, for example, a physical therapist, but then also prescribe this digital therapeutic that you go home and do. That way, the physical therapist can monitor your progress, and not only that, but they're getting feedback about how many times you did the exercise, and maybe seeing how helpful the exercise is. So that'd probably be the simplest example.
Got it. And Bobby, do you also have examples? We talked about.
Yes, I would echo Dr. Mills' point, because oftentimes people ask this question whether digital or non-digital, or whether human or digital. But I would say this is really the combination of the solutions. Even one given patient, maybe at the early stage, you need some in-person therapy, then move on to the medication. But at some point, that digital solution can help to identify or better assess. So rather than saying A versus B or A versus C, I would say the digital solution can have plenty of opportunity, if that makes sense.
And then side effects. I know we had talked about that earlier. I'd love you to point, put a point on that too. The difference between medication, the risk and reward, versus a digital therapeutic, which may not have a side effect.
Right. So the conventional pharmacological solution, unfortunately, there is a risk against the benefit. That's all the FDA is judging. But when it comes to DTX, maybe the risk side or safety side of concern may be decreased. So that's another reason why I think whether drug or digital, but we can use both ends at the same time to get the better result.
That's great. You both talked about data, and sort of a very important component is sort of tracking patients and their progress. Allowing whether it's a physical therapist or a clinical psychologist or someone to see how a patient is progressing. Do we have the systems in place to track that data? Is that something that is going to be a challenge, easy to do, hard to do? Maybe Neil, take that.
Sure. It seems that there, could potentially be, hundreds of thousands of digital therapeutics at some point in the future, considering how much can be turned into evidence-based guidelines and done at scale far cheaper than the way it's done today. And so the question is how do you get that information, or how much of that information needs to get into the electronic medical records? And second, there's no single doctor that could keep in mind the thousands of apps that are coming in and each unique one that each patient is using. So those are going to be some challenges.
For sure. Bobby, what's your perspective on that?
Yes, the challenge side, I agree with Dr. Mills' sentiment. At the same time, if I point out the data in, let's say, the positive lens, that may, I would like to believe that will help patient to realize where you are standing in terms of your patient journey or your life, I would say, because even before you realize you are developing some disease, or even before you are realizing if this medication is really good for you, there is some reaction in your mind or in your head. But as a lay person, as a patient, it's really hard to tell to the physician. Maybe even trained physician, it's really difficult. But if we can collect data and analyze in appropriate algorithm, then both physician as well as patient can understand. That I hope will motivate the patient herself to live or to change her behavior so that she can have just a little bit of better time to smile.
Yeah, that's great. That's a very good comment. With that, let's go to the impact on the patient, which you've already covered a little bit. We talked about the side effects in taking medicine. Are the patients patients feeling good about this? Are they excited? Are they embracing it? Are they driving it? What have you experienced so far?
It's me.
Oh, sure, Bobby, go ahead.
Oh, excuse me. Yes. So far, my company has not yet commercialized any of the product, but my sense is patients really would like to enjoy the new technology if there is any available. At the same time, as a offerer, we have to be mindful about the sensitivity and the privacy issue, etc., etc. But if we can utilize the data, I believe it's not only the on-point care, but also much more broader benefit for patient, as well as maybe caregivers, so that they can experience a happier or maybe, how can I say, the healthcare experience.
Yeah, a better experience. Yeah. Great. Neil, do you agree? Is there any other?
Yeah, the other thing that Aon is on the surveillance for is how can the digital therapeutics help address some of these social determinants of health? The knowledge, the confidence, and the skill sets, vary by zip code and down to the neighborhood. And so there's going to be a keen interest on the digital therapeutics being able to meet where the patient's skills are and their confidence and help closing that. And so that's an area of keen interest.
That's awesome. I also wanted to touch briefly on whether value-based care is a driver. We obviously COVID has changed the environment so much for healthcare, but in the last year, the emphasis on value-based care has really increased too. So what role is that playing? Neil, if you could sort of start us off there with the connection with value-based care.
Sure. So there's a keen interest by employers, any of these therapeutics, digital therapeutics that could reduce surgeries for certain conditions where we know that, it's a little bit ambiguous whether the surgeries are even helpful, anything that could reduce hospital admissions or improve outcomes or improve lifestyles for those with chronic conditions are going to be of great interest to employers.
Right. Yeah, great. Good. Bobby, any comments on value-based care and how it's going to impact?
Yes, I have the same thoughts, so to speak. So with the digital solution or digital therapeutics, we can collect or utilize the data more than used to be. And therefore, it probably easier and reliable to show the evidence of your value or your care. Therefore, the digital therapeutics will play a great role in terms of the value-based care approach.
Got it. Yeah. And Dr. Mills, I wanted to give you a chance to maybe talk about the results of your 2020 health survey that showed that virtual care solutions and digital support are at the top of the list for new benefits for employers. Didn't know if you wanted to.
Yeah, and I think that dovetails nicely with that whole virtual care tier and how employers can incentivize and get this front of mind or top of mind for those that are about to engage with the healthcare system. Because in many instances, what's on your smart device or some of these medical devices that are going to deploy digital therapeutics in tandem, this was not only a cost savings opportunity, but it could be an improvement in the quality of your life and how you have to go about spending your time.
Right, right. And just out of curiosity, the digital therapeutics that are out there already, is this a big time commitment? So many people do want to just say, hey, I have diabetes and my life is so busy as it is. I just need to take the pill and, or the injection and deal with it that way. I don't have time. Is that been a resistance?
There may be some time spent by the employer trying to figure out which digital therapeutics are going to be best or which they can work with your carrier to deploy. Then they're going to spend some time on making sure that they engage the right populations. In fact, unfortunately, sometimes you may have a perfect solution or a perfect tool, but it's not going to be adopted by your employees because of their lifestyle or their financial impoverishment or back to the social determinants of health. And so employers should be very careful about the ones that they choose, not throw too many at their employers. Preferably, they would be one stop for multiple chronic conditions, for example. But the interventions are going to be around raising the awareness around your lifestyle. So stopping you at critical moments during the day, but the employee or the family member has to be open and amenable to taking a power pause and checking in on themselves and making sure they're making the right lifestyle choices. But that's also where the greatest power is in these digital therapeutics is changing our unhealthy habits into managing ourselves better. And the only way this can be done is through digital therapeutics, because we only spend 15 minutes typically in front of our doctors, whereas these can be carried in your pocket and you can get prompts throughout the day to achieve better outcomes.
Right, that's so true. Yeah, great. Bobby, you're shaking your head. Yes, any other comments?
No, I'm completely agree, and that's the beauty of the digital solution. You can bring whenever or whenever. Of course, we would like to live the healthier, happier life without any help from a medication or a physician. But oftentimes we have to face with those moments, those sad moments, difficult moments. You yourself were as a bystander, as a caregivers. So the digital solution can hold many promise, not only the conventional therapy, but also make the community much more happy place.
Yeah, got it. Good. Well, I don't know if you have any final comments, but there are some questions that I'd love to get to. Should I just jump right to the questions? Sounds good. Okay, I'm going to kind of go in a random order here. There's one here is that what type of pricing structures or models will payers expect for digital therapeutics? Is that a fair?
I'll go first. First of all, I mean, we talked about value-based care and we didn't get to this earlier, but is this something that can be included in sort of a bundled payment, meaning that the doctors are incentivized to prescribe or recommend these? The carrier is also incentivized. So that would be one, or perhaps even tying this to the desired outcomes. Maybe it's a hemoglobin A1C or a spend in trend for a particular disease class. Those are reasonable expectations, and those type of discussions should be brought at the table during negotiations. I would also be very careful around defining what engagement is. You know, one interaction with a digital therapeutic over a 6-month period does not define engagement. So look carefully at how engagement's defined.
Got it. Someone asked how you deal with state licensing restrictions. Is that something that that's come up?
Well, we know I'm curious about Bobby's response on this, but when I hear about state licensing, I'm first and foremost worried about the credentialing of clinicians, doctors, pharmacists, nurse practitioners, physician assistants. And if they're prescribing a digital therapeutic, maybe to someone virtually that's in another state. So think of an employer who tried to expand the network for mental health. And so you have a therapist perhaps in one state trying to prescribe a digital therapeutic in another state. There may be some issues there, but that's the only one that's quickly coming to mind. Bobby, anything else?
Thank you for putting me on the spot. But as far as I understand, pre-COVID, there is a restriction on the usage of telemedicine, but because of the situation, there is a change or leniency on that restriction. And because of that, there is a vast majority of a huge increase by patient as well as providers. One of which is, of course, the state licensure, and that is not something like a payer or a provider or even a digital solution offerer can solve on their own. Maybe collectively we can show again the data as well as the education to the policymakers so that we can make most of the promise of a digital solution, which is everywhere, anytime.
Got it. Thank you, Bobby. Somebody asked this question. I think it bears repeating, even though we discussed it a little bit. They say, I've always seen digital health as the umbrella term, which encompasses other areas with digital therapeutics as a branch. However, from your discussion, you kind of mentioned digital therapeutics as completely different from digital health. Is that true? Is it completely different than digital health, or is it sort of under the umbrella of digital health with the sort of evidence-based sort of outcomes?
Seems to be a subset of digital health. It's those that are really focused on the evidence-based guidelines, and it seems that it could be a subset is probably the best way to think about it. Maybe a continuum, on a continuum.
This is an interesting question. Will digital therapeutics leave an aging population behind? So if they're not using smartphones, are they, are we going to find that it's just for younger people?
I do not necessarily think so. In fact, I think not only this country, but also some other foreign countries, there is a use case, maybe pilot scale, but bringing, let's say, VR technology to the long-term care system, a senior living home, so that they are stimulated in terms of the brain or cognition. Therefore, I get that point that the younger generation will be good at manipulating the smartphone as opposed to senior generation. But even today, there is a space we can apply the digital solution, let alone 10 years later or 15 years later.
Got it.
Can I add something here real quick? You know, the early adopters are typically younger people, but there are digital therapeutics already tailored towards people, let's say over the age of 50, which I'm over the age of 50. So, and they do gait analysis. They're monitoring your heart rate, heart rhythm, respiration, pulse oximetry. So that'd be oxygen saturation. And those are going to be tied to digital therapeutics and guidelines driven by AI that help improve outcomes. So I don't think, I mean, they may be slower adopters, but we're still going to have lots of digital therapeutics geared towards people over the age of 50.
Agreed.
Got it. One of our startups today talks about how in the area of CNS, where almost every endpoint is measured in terms of behavior, digital therapeutics are almost required alone or combined with PARMA because it's not possible to, quote, swallow a behavior. Do you have any sort of reaction to that one?
Well, I also saw in the chat there was a question about substance use disorders, and maybe it's great to tie these two together in the response. You know, unfortunately, substance use disorders are a problem in the US from those that are, you know, legal, sometimes problems with alcohol and smoking. But then on the other end of the spectrum, from things recently legalized like cannabis, because we have something called cannabis use disorder, to illicit drugs like fentanyl. And so unfortunately, that being tied to overdoses and unnecessary deaths right here in our society. And there's some great promise showing that virtual therapies and digital therapeutics are showing improved outcomes for those through helping with the recidivism and the relapse rates and compliance with the drugs like buprenorphine and naloxone, which help reduce those simply because there's better real-time surveillance and check-ins with the therapists that are helping you overcome you know, these hurdles to having a good life.
That's great. We're kind of at the point where we need to wrap up so we can get the startups on stage. Any final comments, Bobby or Neil? No? Good. Thank you so much for joining us. We really appreciate your time today and your insight. And I'm going to wrap it up here and hand it over to our startups.